So welcome all to this today's presentation of progesterone only pills. This is also very frequently asked. We begin with our code Master MRCOG with concept oriented clarity. So what about the progesterone only pill? So what is the effectiveness and use? It is 99% effective when taken consistently and correctly. So it is a very good contraceptive. Then enzyme inducing drug, is there any affection? So if the patient is on enzyme inducing drugs, then prefer is injectable or intrauterine contraception. So enzyme inducer, we will have a separate discussion for it. But remember, parenteral progesterone (PP) can be given. Okay, in parenteral progesterone, you have injectables, you have LNG IUS that can be used. Okay, if the treatment is within 2 months, this enzyme inducing drug treatment is a short, less than 2 months duration. In that particular case, what the guideline says, you continue progesterone only pill along with extra precaution during and 28 days after the treatment. So suppose enzyme inducing drug is to be used for that particular patient who is using the progesterone only pill, and if the duration is less than 2 months for the enzyme inducer, then we will continue to use progesterone only pill, but additional precaution will be required for the duration for which enzyme inducing drug is required plus 28 days after that. Okay, and after stopping such drug, use condoms for 28 days. So additional 28 days also you have to continue the additional protection. Okay, now if it is a digesterol pill which inhibits the ovulation, remember there is a difference between the mechanism of action of traditional POP and the digesterol POP. This digesterol POP will act by inhibiting the ovulation, while traditional POP will act by its action on the mucus, cervical mucus. Okay, so this digesterol pill inhibits the ovulation in 97% of cases, and they have got a 12-hour missed pill window, while traditional pill will have only 3 hours of missed pill window. Okay, now let's talk about adherence. Now this particular pill, progesterone only pill, is to be taken on the same time daily for the best efficacy. If the patient vomits within 2 hours, she can take another pill. If it is missed, go for use precautions. She will have to use precautions for additional 48 hours. Okay, if she vomits within 2 hours, okay, then another pill is required. If another pill is not used, then additional precautions are required for 48 hours. Okay, then what is the effect of BMI and body weight? There is no proven effect on efficacy or no need for higher dose. Now, what are the health benefits and concerns? Possible benefit, it will improve the dysmenorrhea. There is no proven link with cardiovascular disease, breast cancer, or mood changes. Ectopic pregnancy, about 1 in 10 POP failures can have fertility returns quickly after stopping the POP. Okay, there is a quick return of the fertility. Okay, what are the side effects? Irregular bleeding is the common side effect with the POP. Weight change or libido effects, there is no proven association. Then follow-up, the patient can be given 12 months of supply, review as needed, return for consultation if there are any issues, and she may continue progesterone only pill until the age of 55. Okay, now what about once the patient crosses the age of 50 years and she is amenorrheic, then what to do? Okay, what is required? You have to check the FSH level 2 times 6 weeks apart. If both values are more than 30, that means FSH is in the range of menopause. In that particular case, continue the progesterone or barrier contraceptive for 1 year. Okay, so she can use the POP ideally until 55 years of age. But if she is more than 50 years of age and she becomes amenorrheic, then what to do? Okay, if she is amenorrheic and she is more than 50 years of age, then you will check the FSH 2 times 6 weeks apart. If both values are more than 30, in that particular case, contraception is advised for 1 year only. Okay, so after that you will continue only for 1 year, either POP or barrier contraception. Okay, but if the values are less than 30, then again yearly you will go on doing this, and once the values are more than 30, you will advise the contraception for 1 year only. Okay, changing the POP type or dose rarely improves the bleeding, but may help sometime. Okay, now coming to the missed progesterone only pill. Okay, how does the these particular pills act? So the ovulation suppression is seen with the traditional POP only in 50% of the cycles. So they will act mainly by its action on the cervical mucus. Ovulation is suppressed only in 50% of cases, while desogestrel pill, they are very particular about suppressing the ovulation in 97% of cases, and it has got a 12-hour missed pill window. Okay, now coming to the risk timing. So traditional POP, if more than 27 hours since the last pill, protection may be lost because it has got a 3 hours window. Okay, so 27 hours since the last pill. If it is not taken within 27 hours, then it is considered as a missed pill and there will be loss of protection. While desogestrel pill, it has got a 12 hours of window. So 24 plus 12, that is 36 hours since the last pill. After that, the protection will be lost. Then sex before missed pill. Now, if there is a sex before missed pill, it does not require emergency contraception. That means she has taken the pill at 9 o'clock yesterday night. The next pill will be taken till 12 o'clock in the midnight today. Okay. But if there is an intercourse at 11 o'clock, in that particular case, emergency contraception is not required if it is a traditional POP. And same if it is up to 36 hours, in that particular case, emergency contraception is not required. Is this concept clear to all of you? Is this concept clear?
Yes, sir.
Okay. What to do if a PL is missed? Okay. Now we are talking about more than 36 hours in case of desogestrel pill and more than 27 hours after the traditional POPs. Okay. Then we will consider that this as a missed pill. Okay. Then in that particular case, take the missed pill as soon as remembered. Okay, only one pill, even if more pills are missed. Okay, if the pill is missed, then take the pill as early as possible. Okay, take the next pill at the usual time. Okay, that means she may take 2 pills in 1 day also. Additional protection or condom or abstinence for at least 48 hours after restarting the pills. And emergency contraception needed if there is an unprotected sexual intercourse after missing the pills and within 48 hours of the restarting of the POP. Okay, in that particular case, emergency contraception will be required. Then key advice is that take the pill at the same time every day for the best protection. Desogestrel POPs are preferred for more flexibility, that it has got a 12-hour window and stronger ovulation inhibition. That is 97% cases it protects. So these particular values, sometimes they can ask you as a numerical SBH. Okay. So this is the same thing what we have discussed. Traditional POPs more than 3 hours late, that is more than 27 hours since the last pill is taken in cases of traditional, and in cases of desogestrel pill, 12 hours window, that is more than 12 hours late, more than 36 hours since the last pill was taken. The missed pill should be taken as soon as remembered. If more than one pill has been missed, only one pill should be taken. The next pill should be taken at the usual time. This may mean that 2 pills are taken in a day. Additional contraceptive precautions, that is condoms or avoidance of the sex, are advised for 2 days, that is 48 hours after restarting the POP. And EC, that is emergency contraception, is indicated if unprotected sexual intercourse occurred after the missed pill and within 48 hours of the restarting of the POPs. Okay, so this EC will be only if there is a UPC. Okay, now let's see what does this chart tells about. So this chart talks about advice on starting the POP. Okay, when will you start POP? So any hormonal contraception, remember, you have to what is the situation, whether she is within the having a normal menstrual cycle, or whether she is amenorrheic, or whether there is she is in the postpartum period, or whether she is in the post abortal, that is first trimester or second trimester. Okay, so these situations we need to see. Okay, now if she is having normal menstrual cycle, then within first 5 days, up to 5 days she can start. There is no need of additional precaution. Okay, but if she starts after 5 days, then additional precaution will be required. up to 48 hours. Okay. And if there has been a risk of pregnancy, consider pregnancy test, and EC and quick starting, okay, is required. Okay. So if we are starting the POP after 5 days, okay, then additional precaution will also be required. But if there is a unprotected sexual intercourse, in that particular case, emergency contraception will also be required. Okay. And pregnancy test will be required if there is a UPC 21 days before the this particular thing, and you can go ahead with the quick starting contraception. But if it is in the first 5 days, nothing is required. Okay. No additional precautions are required. Okay. Now if the woman is amenorrheic, that means she does not have periods, in that particular case, you can start progesterone only pill anytime. However, additional precautions for 48 hours are required. You have to do pregnancy test prior to the starting. If pregnancy test is negative, but there is a UPC in the last 21 days, you will give EC. Okay. And you will start with a quick starting POP and repeat the pregnancy test after 3 weeks. Okay. So now when she is amenorrheic, the first thing what you have to do, you will do the pregnancy test. If the pregnancy test is negative, then you will start her on POP. Okay. But if there is a emergency, if there is a unprotected sexual intercourse within last 21 days, then you will give EC. Okay. And you will do the repeat pregnancy test after 3 weeks of the unprotected sexual intercourse. Okay. Especially when the woman is amenorrheic. So they may ask you in one of the scenario, and this all options will be given in the EMQ format. So there will be 12 to 14. So you just have to remember what exactly you are going to do for an amenorrheic woman. For amenorrheic woman, what will be the first action? Yes, doctor?
Pregnancy test. To do pregnancy test. Rule out pregnancy.
Pregnancy test is negative. Then you will quick start POP. Okay.
POP.
POP will start. Then you will look into, is there a unprotected sexual intercourse in the last 21 days? If it is there, then she will also
give an emergency
contraceptive. Okay. And you will also repeat UPT after 3 weeks of the unprotected sexual intercourse. Okay. So that is how you have to choose the option. Then coming to the postpartum status, breastfeeding, then whether she is breastfeeding or non-breastfeeding. Remember, up to 21 days, there is no need of any additional contraception. You can just start these POPs anytime. POP can be started at any time after the childbirth, including immediately after the delivery. You can start POPs. These are the only contraceptive oral contraceptive which you can start immediately. Okay. So, and no additional precautions are required if it is started within 23 weeks. But if you are starting after 21 days, then the additional contraceptive will be required for 48 hours, unless the patient is using lactational amenorrhea method. Okay, lactational amenorrhea method means patient is exclusively breastfeeding to the baby. Okay, and this is effective up to 6 months only. So after 21 days, you will use advise additional precautions for 48 hours, unless she is using LAM. Okay, if there has been a risk of pregnancy, then consider pregnancy test, emergency contraception, and quick starting, as we have already discussed. Then first trimester and second trimester abortion, up to 5 days, nothing is required. POP can be initiated after the first part of medical abortion. Then after 5 days, what she will require additional contraception for 48 hours. If there has been a risk of pregnancy, then consider pregnancy test, emergency contraception, and quick starting. Okay, so these are the things which are required. Okay. What is this last? Just a moment. Now this particular chart tells us about the switching from another method of contraception to progesterone. That means she wants to start progesterone only pill. Currently she is on some other method. Okay. Now let's see what she may be using combined hormonal contraception, or she may be using another POP, or she may be on implant, she may be on progesterone only injectable, and she wants to shift to the progesterone only pill. Okay, if she is using combined hormonal contraception and if she has taken it correctly, then up to first 2 days of HFI, That means a hormone-free interval. She has stopped her previous pack, finished her previous pack, and she is starting within first 2 days of the HFI. HFI is a hormone-free interval. In that particular, no additional contraception is required. Day 1 is the optimal time to switch. So first day of the HFI is the ideal time. Okay, but day 1 and day 2 HFI, nothing is required. But if she's starting the POP from day 3 onwards of the HFI or week 1 following the HFI, in that particular, she will require additional contraceptive for 48 hours. Okay, but if there is a UPC occurred after the day 3 of HFI, then what advise continuing the CSC method for at least 7 days. Okay, in that particular case, she will have to use combined hormonal contraception, okay, for 7 days. Okay, and if CSC cannot be continued, switch to POP immediately and consider the need for emergency contraception and PT. See, here she is taking the combined hormonal contraception. Now, combined hormonal contraception, here suppose HFI is for she will have a HFI of 7 days. Okay, but up to first 2 days, nothing is required. But in first, she is starting after 3 days. In that particular case, if there is a UPC, in that particular case, still there is a time for the CHC to act because she is still in the HFI of this CSC. So CHC is to be continued for 7 days. Okay, this is what they want to see. And if CHC cannot be continued, then switch to POP immediately and consider the need for EC and pregnancy test. Okay. Now, if she is starting the progesterone only pill in the third week, second week or third week of the combined hormonal contraception, in that particular case, she does not require the additional contraception. There is evidence to suggest that taking hormonally active pill for 7 consecutive days prevents ovulation in the subsequent 7 days. Now she is in the second and third week of CSC. So she is taking combined hormonal contraception. So if she has taken in the first week correctly, that means ovulation is already inhibited. So you can, next 7 days, the ovulation will be inhibited. That is why she does not require additional precaution. Is it clear? Is this concept clear to you? This particular week 2 and 3? If not, I can explain you again.
Yes, sir.
That means she has taken in week 1 properly. That will inhibit the ovulation for next 7 days. So after 1 week, the ovulation is inhibited for 1 week. So she can start the POP in the week 2 and week 3 safely without using additional contraception. Okay, this is straightforward explanation for this. Now she is on another POP. Then she can shift to another POP at any time. No additional precautions are required. Okay. Then progesterone only implant, if she is using, it is working for 3 years. So if it is valid within 3 years, then no additional precautions are required. If the duration of the implant is more than 3 years, in that particular case, 48 hours of the additional contraception is required, and EC will be required, and pregnancy test can be required if the pregnancy cannot be excluded. Okay. Then progesterone only injectable. Now progesterone only injectable can be given up to 14 days. Okay. So from the last injection, the next injection will be given after 14 days. So within that particular validity, if she is taking the POP, then no additional contraception will be required. But if she is starting the POP after 14 weeks, since the last DEMPA injection, that is depoxymedeoxyprogesterone injection, then she will have to use the additional precautions for 48 hours, and there will be need for EC and pregnancy test if pregnancy cannot be excluded. Okay, if there is an unprotected sexual intercourse, she will be using the emergency contraception. Okay. Now, if she is shifting from LNG IUS to POP, in that particular case, if there is no unprotected sexual intercourse in the last 7 days, then no additional precautions are required. Okay. No additional additional precautions are required. Okay. IUS is continued for 2 days because it takes action will be there for POP within 48 hours. Okay. And if there is a UPC in the last, there is no UPC, it is not required. Okay. Or if she doesn't want to use the IUS for 2 days, then definitely additional precautions are required. Okay. If the IUS is removed or out of date. So if the LNG IUS and there is a no UPC in the last 7 days, additional precautions are not required, provided IUS is continued for 2 more days. Okay. But if it is not continued in that particular case, if the IUS is removed, then additional precautions will be required. Okay. Now, if there is a UPC in the last 7 days, then definitely additional precautions are required. IUS can be written for 7 days and UPC should be avoided for 7 days prior to removal of IUS. Consider the need for emergency contraception and pregnancy test if pregnancy cannot be excluded. So if she is using LNG IUS and wants to shift to POP, then check whether there is a UPC in the last 7 days or there is no UPC on the last. If there is no unprotected sexual intercourse in the last 7 days, additional precautions for 48 hours if the IUS is removed. If the IUS is continued for 2 days, then there is no need for the additional precaution. If there is unprotected sexual intercourse in last 7 days, retain the IUS for 7 more days. Okay, so this is about the LNG IUS. Now, if she is using copper iodine and wants to shift to POP, in that particular case, first 5 days of the cycle, nothing is required. After day 5 of the cycle, and there are no unprotected sexual intercourse in the last 7 days, keep the IUD for 2 more days, nothing will be required. Okay. If IUD is removed, then she will require additional protections for 48 hours. Okay. And after 5 days of the cycle, and there is a UPC in the last 7 days, in that particular case, IUD is to be retained for 7 days. Okay. And additional precautions are required. Additional precautions are required, which you can continue the IUD for 7 days. And UPC should be avoided for 7 days prior to the removal of an IUD. Consider the need for EC and pregnancy test if pregnancy cannot be excluded. Then coming to the barrier methods. Barrier methods can, in the first 5 days of the cycle, it can be used. No need of additional precautions. After 5 days, definitely for 48 hours, the additional precautions will be required. And consider the need for emergency contraception and pregnancy test if the pregnancy cannot be excluded. Okay, so that is what is if she wants to shift from one contraception to the progesterone only pills. So that finishes the topic of progesterone only pill. Thank you.